Burns. My name is Karen Andrews. I'm a nurse midwife. Is it okay that I call you Mrs. Burns, or would you prefer to be called Kristen?
You can just call me Kristen.
Okay. Do you understand what a nurse midwife is and my role is today? Any questions on that?
No.
Okay,
I think
fantastic.
so.
All right, so we'll just get started here. Can you tell me what brings you in today to see me?
Just a well visit today.
Okay, any issues or anything outstanding or any chronic illnesses or anything we need to talk about before we get started?
No.
No problems at all. When was the last time you were seen by a provider?
I think my last exam was just about a year ago, so I think it was September.
Okay.
Last September.
Any issues that came up at that time or anything they were treating you for or monitoring or anything like that that you can remember?
No.
Okay. Well, let's start by talking about some of your immunizations. Are you up to date? And if so, what have you had, and do you know when you had them last?
Yes, I am up to date. You know, being in school, I have to be up to date with those. So September of 2011, I've gotten all those done. Can't think of all of them. Can you?
Like a hepatitis B shot, did you have your series done, or?
Oh yeah, so I had all those done in September. I didn't get the pneumonia vaccine because I didn't have any risk factors, so I didn't think that was necessary. But the tuberculosis, that was negative.
Results on that, and update on your flu shots and everything like that for school. Sounds
Yep.
fantastic. Okay. Well, let's talk about some of your allergies. Do you know if you have any allergies to foods or drugs or the environment or anything like that that you can think of, or pets or anything? Okay.
No allergies at all.
Have you taken penicillin in the past, or have you had a reaction to that you know of?
Yeah, I've taken before. No allergies.
Okay. Any frequent contact with latex or an allergy that you've noticed before in the past?
I do have frequent contact with latex. I'm a nurse, so, but yeah, no allergies, no problems.
Nothing like that. Okay. Let's talk about any past hospitalizations or surgeries you've had.
I did have my wisdom teeth out taken, 1999 it was, so a little while ago. No problems with that. It was easy procedure.
So no problems with anesthesia or anything during the procedure?
No.
Okay.
And then I had a baby girl in 2008, 38 weeks, regular vaginal delivery, not.
No complications, regular hospital stay, went home within?
Yeah, regular hospital stay. I did have an epidural. I had preterm labor that I was on bed rest for about 6 weeks, but besides that, yeah, normal delivery.
You weren't kept longer than you did for any complications at that time?
Nope.
No unusual bleedings or bad reactions or anything like that?
No, it was good.
Alrighty. So in the past, have you had any accidents or injuries, falls, anything like that, where you've been treated for?
No.
Or hospitalized for anything like that? Okay. Tell me what kinds of medications you take at home.
Oh, you know, I take my 2 gummy vitamins. I give them to my daughter, and I take them as well myself. So 2 gummy vitamins a day, and then I do have headaches a lot, just related to TMJ. I see a dentist, and he's aware of that. So I just take ibuprofen as I need it, usually like 400 to 600 milligrams. So.
Okay, that sounds good. Anything else that you can think of, homeopathic or over the counter, or nothing prescribed to you that you take on a regular basis?
No.
Okay. Do you ever use any alternative medicines like acupuncture or see a specialist or chiropractor or anything like that?
No.
Okay. We talked a little bit about your prenatal history, which we've covered, which is good. Talk about, or tell me about some illnesses in your side of the family, any chronic illnesses or cancer, or diabetes, or obesity, or anything like that.
Sure. My dad actually passed away at the age of 41 from a heart problem. Hypertrophic obstructive cardiomyopathy.
Okay.
So that's definitely significant in my family, and I've been checked out for that.
Okay. What did they do for that when you said you were checked out for that?
I did have, with Dr. Elahi, he's at Methodist, I followed up with him, let's see here, 2011, I don't remember the exact date, but we did an EKG, we did an echocardiogram, those were all normal. So I'll follow up with him in 6 months. 6 months would be November of 2011, so.
Okay.
It's scheduled.
Okay. So any other chronic illnesses or anything like that in your family that you can think of?
Yeah, diabetes is pretty prevalent. So my mom's mom, my dad's mom, and my dad's father also. So.
Okay. Anything that you've noticed in yourself as far as symptoms of diabetes at all?
No.
Okay. Very good. Any allergies or asthma or anything like that in your family?
You know what? I thought of something else too. My mom has hypothyroidism. She takes Synthroid, so 75 micrograms every day, and then obesity, just a couple ants, but I try to watch out for that.
Okay. Things like high blood pressure, heart disease, stroke, blood disorders, genetic birth defects, neurological problems, seizures, emotional, anything like that, drug abuse, anything like that you can think of?
No,
okay.
thankfully.
Who lives at home with you?
My husband and I and our 3-year-old daughter. Well, she's 4 now.
Fantastic. And what do you said you were a nurse?
I'm a nurse,
okay.
yes.
And do you work at, where do you work?
Labor and delivery at Methodist.
Okay, very good. Any incidents where you've had an injury there or problems with hazards or?
I mean, I'm exposed to bloodborne pathogens, but no, I haven't had any problems.
You
so
take all the precautions necessary to keep yourself safe.
Yeah.
Okay. And how do you perceive your financial resources, your health care for your family, insurance coverage, and things like that?
Everything's good. I have insurance, so finances are okay. Everybody has
As good as it
problems,
can
but
be.
Yeah, it's
All
good.
right.
Yeah.
And so you're a nurse. How many years of school have you completed?
I graduated from my undergrad from ISU in 2005, and now I'm a master's student at UIC in midwifery program.
Fantastic. Okay. Any social habits that you can think of that would be significant to your health history? You smoke, you
No.
have an occasional drink, or
Occasional,
drink very
probably like
much?
1 to 2 alcoholic beverages per month. Just depends on when I get out with my tight schedule. And I am a caffeinated drinker. I have probably, I'd say 2 drinks daily or so.
Okay. Any illicit drug use?
No.
How about your sleep patterns? How often do you get 8 hours? Is that average for you, more or less? Or
Yeah, 7 to 8 hours, I'd say. I wake up pretty well rested. I'm pretty good about the sleep.
Problems with insomnia or waking up a lot at night or anything like that? Okay. What about your exercise, your activities, and what do you do in your spare time?
Exercise, no real program right now that I'm in, but I do go for walks, kind of just as a stress relief with my dog, my daughter, but no real programs, just
Not a
leisure
real
walks.
regimen. Okay. Talk about your food intake. Give me an idea of what you've had in the last 24 hours.
We'll just talk about yesterday. How about that?
Yeah, sounds good.
Well, wake up, I had a cup of coffee with some creamer, a yogurt, just low-fat yogurt, and I did have a bottle of water.
Okay.
Lunch, I had a Jimmy John sandwich. I had a turkey sandwich with cheese and lettuce, avocado, tomatoes and cucumbers, and I also had a Diet Dr. Pepper. So that's my caffeine. And then for dinner, just a bottle of water, 1 glass of white wine with my grilled chicken breast and mashed potatoes.
Okay. How often a week do you think you go out to eat at a restaurant?
Probably 2 to 3. Sometimes more, sometimes less, but usually about 2 to 3.
Not too bad. Now, you mentioned that you're in school and you also work. Talk about your stress in your life and how you cope with stress management.
Just taking time away, getting some massages, playing with my daughter, going for walks. Just that's about it.
Have you ever felt like you needed to look for help outside to manage your stress?
Yeah.
Talk to somebody or anything like that?
I do pretty good.
Okay. Any exposure to violence inside or outside of the home in your past, or been afraid to be at home?
No, I mean we do have a gun in our house, but it's in a fire safety box and it's locked and it's unloaded. So.
Very good. So safety measures that you use, riding a bike, you wear a helmet, wear your seatbelt, or things like that, or talk to me about how you make sure that you're taking care of yourself in those ways.
Yeah, always wear my seatbelt. If I do ride a bike, which I usually don't, but I would wear a helmet.
Smoke detectors, we talked
Yeah,
about gun
smoke
safety,
detectors,
things like that.
Smoke detectors and carbon monoxide detectors in our house are working. So.
Okay. All right. We talked about how you're taking care of yourself at work, and that's good. Do you have any particular religious affiliation?
I'm Christian, but nothing that would affect anything. You know.
Okay. Nothing outside that has to do with how we handle your healthcare and like that, or certain beliefs or things like that.
No.
Okay. We'll talk more about how you've been feeling lately and just more about your body. Have you noticed lately that you've been overtired, that you've had any fevers, chills, night sweats, weight gain, weight loss,
No.
anything like that? Felt like you couldn't get up and go to work?
No.
No? Lots of energy. When you take something for pain, give me a number on a scale from 1 to 10 of how that feels when you think you need to take some ibuprofen.
I'm not having any pain right now. I would say if I have a headache, it's just kind of annoying pain. I guess I never really thought about rating it on a pain scale of 0 to 10. So, I don't know, maybe like a 2, just there.
All
When
right.
I take my ibuprofen.
But nothing right now?
No, nothing right now.
Very good. Notice anything as far as your skin and nails, unusual moles, cracking your fingernails, losing any hair, or unusual hair growth?
No, I think everything everything's normal. I usually wear sunscreen to kind of prevent any burns or anything like that. I guess that's
Okay.
about it.
Very good. Anything on your scalp? Anything that you've noticed? Itching, dryness, spots? We talked about you haven't noticed that you've lost any hair or anything like that, okay?
Yep. I do get it colored, of course,
Okay.
every 6 to 8 weeks or so. So,
You
yeah,
get
highlighted.
Okay. How often do you wear your glasses?
Just nighttime driving usually when I'm at school.
Okay. So not all the time. You don't have to wear them all the time.
Mhm.
Just for near vision or for far?
I'm nearsighted, yes. I
Nearsighted.
can't see far away very well.
Okay.
Yeah,
And when
that's
was
right.
your last eye exam?
Last eye exam, oh goodness, let's see, November of 2011. So.
Any problems at all at that exam or?
No,
No.
no.
Okay. Any issues with recent hearing loss, pain, discharge, ringing in your ears, being dizzy? You don't
No.
use any assistive devices to hear, nothing to help you hear, anything like that?
No.
Do you get frequent colds, nosebleeds, sinus pain infections?
No.
No, nothing like that?
Pretty healthy.
Okay. How often do you brush and floss your teeth?
Like in the morning and night, if I can before, after every meal, but usually it's just I don't have a toothbrush around, so flossing
Okay.
probably about every other day or so.
Okay. And when was your last dental exam?
Oh goodness. I'd say my last exam was probably about 5 months ago.
Okay.
And
And everything okay with that?
Yeah, I just have that TMJ,
Right.
but the doctor, he's the headquarter in Illinois, so he's taking care of it, and just ibuprofen for right now. There's alternative therapies if I need it down the road, but I'm okay.
Sounds good.
Yeah.
Any missing teeth or problems with your teeth at all, or being treated for anything for your teeth?
No.
Very good. Any stiffness in your neck, unusual swellings, lumps, tenderness, difficulty swallowing, anything like that that you've noticed?
No, just a little tightness in my neck just from carrying these heavy bags, but
Ah,
no, it's
okay.
fine.
All right. Do you do breast exams on yourself? Okay.
Mhm.
Have you noticed any unusual lumps, drainage, discoloration, anything like that?
No.
That you've noticed? Okay. Any shortness of breath, cough? If you've been coughing, have you noticed that there's a certain color to it or a certain amount? Wheezing? Do you
No.
have asthma?
No.
No. So far, so good. And you said you're not a smoker.
Right.
So, okay, very good. Pain in your chest. Your blood pressure is usually within a normal range. History of any heart murmurs or high cholesterol?
No, just that, I see Dr. Elahi, remember I
Mhm.
talked about,
Yeah.
everything was normal there, so we'll continue with EKGs and echoes if needed.
Okay, very good. Normal bowel habits,
Mhm.
diarrhea, constipation, any issues with that you've had at all, or nausea or vomiting, abdominal pain?
I'd just say probably bowel movement like every day or every other day or so.
Okay. Intolerant to any foods, anything
No.
that makes your stomach upset, any bleeding that you've noticed in your stools,
No.
or any glandular swelling down in your groin?
No.
Any swollen glands? No. Okay. Any issues with having to go to the bathroom a lot, to urinate, that you're going a lot, that it hurts, that it burns? Any pain up in your sides over here?
No.
No? Okay. Any unusual discharge that you want to talk about?
No. I think we're good there.
All right. Do you know how old you are when you started your period?
15.
15.
Mhm.
Okay. Talk about your cycles with me. Are they normal? Pretty much on schedule?
It's kind of hard to tell because I have the Mirena. I got it placed in 2008 for a contraceptive after I had my daughter. Don't really have cycles, but I do notice, when I have premenstrual-like symptoms like thin mucus and sore breast. But there's a little bit of spotting when I'm wiping occasionally for maybe like a day, but I don't really have cycles, so
Okay.
I'm not 100% sure there.
So no excessive cramping or premenstrual syndromes, anything like that? Fertility problems that you've had in the past? And you've had your PAP when? Do you know when you had your last PAP?
Oh, last PAP. Actually, it was just September
Okay.
this year, so just like a couple weeks ago.
Anything abnormal with that?
Nope,
Any
no
history
abnormal
of
PAPs.
any abnormal PAPs that you can think of or that you remember? Okay, very good. Let's talk about a little sensitive issue, and this would be your sexual past and your sexual history. You're married,
Right?
in a monogamous relationship.
Correct.
You generally have your sexual relationships with men
Mhm.
only. Okay. Do you know how many partners you've had in your past?
2, but the last 10 years I've only had one, and that's been my husband, so.
Okay.
Yeah.
And you talked about the fact that you're on a Mirena, and that's what you use for contraception, right?
Correct.
So no other risk factors you have as far as being exposed to any STDs or issues like that
No.
that you've had currently? Okay. Have you noticed any problems just with your muscles in general, not being able to move certain muscles? You have limited range of motion with how you move some of
No.
your extremities. Any weakness, any paralysis that you've noticed, numbness, tingling, difficulty walking, or have to use anything to walk?
No.
Nothing like that? Okay. Have you ever had a head injury? Have you ever lost consciousness? Felt like you're losing coordination, dizziness, numbness, anything like that? Tingling? You said you've not had a history of seizures.
No.
Unusual tremors. We talked about the headaches. Losing any memory. Frequently forgetting things more than normal. Okay.
No, I think I'm good.
Been unusually irritable outside of just your school things and all the stress you have, nothing like that, or
I think
mood
I'm
swings
okay.
that would be considered abnormal. Okay. Have you ever tested and had low iron in your blood or been treated for low iron in your blood? Okay. Bleeding tendencies or on any medications for any bleeding? Okay. Ever had a blood transfusion?
No.
Okay. Thyroid problems? I know you said your mom had some history of that, but nothing in yourself, is that right?
Correct.
Okay. So any sensitivity to hot or cold environments?
No.
Okay. Tell me about how your overall mood is on a day-to-day basis.
I'm generally happy. I'm a pretty happy person.
Okay, so no unusual mood swings, or been ever treated for anxiety disorders, or panic or depression, or ever had hallucinations,
No.
or anything like that. Ever been treated for an eating disorder?
No.
Or any type of mental illness?
No.
Okay. Very good. Is there anything else you can tell me that you are concerned about today, or have any questions about today, or that we did not cover that you'd like to talk about?
No, I think you did a pretty thorough job.
Okay. I appreciate your time.
Thank
All right,
you.
thank you.